Well, the emergency committee for the Ebola virus disease met for the third time since the outbreak in Democratic Republic of the Congo started in August of 2018. And they met yesterday, and this is what we come up with. The committee expressed its deep concern about the ongoing outbreak, which, despite some positive epidemiological trends, especially in the epicenters of Butembo and Katwa, shows that the extension and/or reinfection of disease in other areas like Mabalako presents once again challenges around community acceptance and security. In addition, the response continues to be hampered by a lack of adequate funding and strained human resources. The cluster of cases in Uganda is not unexpected. The rapid response and initial containment is a testament to the importance of preparedness in neighboring countries. And of course, Uganda has a great history of containing Ebola outbreaks. The committee commends the communication and collaboration between DRC and Uganda. At the same time, the exportation of cases into Uganda is a reminder that as long as this outbreak continues in DRC, there is a risk of spread to neighboring countries, although the risk of spread to countries outside the region remains low. The committee wishes to commend the heroic work of all the responders who continue to work under extremely challenging and stressful conditions. The committee extensively debated the impact of a public health emergency of international concern declaration on the response, possible unintended consequences, and how these might be managed. Differing views were expressed as the committee acknowledged that recent cases in Uganda constitute international spread of disease. And this were their conclusions. For the third time, it was the view of the committee that the outbreak is a health emergency in DRC and the region, but does not meet all the three criteria for a public health emergency of international concern under the IHR. While the outbreak is an extraordinary event with risk of international spread, the ongoing response would not be enhanced by formal temporary recommendations under the IHR. So, since the outbreak started in August of last year, this is the third time the committee met, and all three times they determined it was not an emergency of international concern. And this is from the World Health Organization Director-General, Dr. Tedros. And he gave a little speech in thanking Dr. Avitslan, who chaired the committee. And I want to read a couple paragraphs of what he had to say. I would like to thank Dr. Avitslan for his leadership of the Emergency Committee and all the members of the committee, as well as the advisors. As you have heard, the Emergency Committee has recommended for the third time, and I have agreed, that the current Ebola outbreak in DRC does not constitute a public health emergency of international concern. Although the outbreak does not at this time pose a global health threat, I want to emphasize that for the affected families and communities, the outbreak is very much an emergency. So this kind of takes me to this question. I thought somebody brought up an interesting comment on my LinkedIn page. And let's take a look at it and let me know how you feel about this. And another round of debate as to whether to declare a global emergency for Ebola in the DRC. And again, the question, what difference would such a declaration make? In other words, what else would be done that has not already been done? As another round of hype spools up, let's be honest with the conversation. Was the appearance of Ebola in Uganda truly unexpected? The answer is emphatic no. Is there evidence of uncontrolled spread in Uganda? No. Do the Ugandans have access to the vaccine? Yes. Do the Ugandans have tremendous prior history and experience dealing with filovirus outbreaks? Absolutely. Then he goes on to make some other statements and other questions that should be looked at. Absolutely. If you would like something to debate, ask these questions. What is the plan for vaccine supply, distribution for countries outside of Africa on the air traffic receiving end? Are we all still comfortable leaving the air traffic grid from this region of the world wide open if there is a loss of control in Uganda? And third, and very important, are we documenting evidence of protective herd immunity in the epicenter of DRC? Move beyond the hype and have a balanced, thoughtful conversation about the issues. So this person that I chose to keep anonymous does bring up some interesting, thought-provoking points. What do you think about them? And just a little update of the country situations, and this is from the Ministry of Health in Uganda, and this was published 20 hours ago. The Ministry of Health received 2 multi-purpose vehicles from World Health Organization and the Irish Embassy in Uganda to strengthen its efforts in containing the Ebola outbreak in Kasese district. This timely donation will help in boosting surveillance and logistics during the Ebola response plan. This donation is in addition to 30 motorcycles the ministry recently received from the 2 organizations, also intended to intensify surveillance. The Honorable Minister of Health, Dr. Jane Ruth Aseng, said, quote, We have only 1 suspect case in isolation in Bwera Ebola treatment unit. Out of the 3 suspect cases we had yesterday, 2 tested negative for Ebola, while results are pending for 1 suspect case that's currently in isolation, close quote. And then she goes on to say she would like to appeal to the nation to avoid shaking hands and any other form of body contact as the country faces the Ebola outbreak. So, as per usual, Uganda is doing a pretty good job of containment, and we've seen that time after time over the past 20 years. And the situation in DRC, and this is the latest numbers from the Democratic Republic of Congo's Ministry of Health. And since the beginning of the epidemic, the cumulative number of cases is now at 2,120 cases. 2,026 are confirmed. In total, there have been 1,420 fatalities. So this has been going on for 10 months, and we're over 2,100 cases and 1,400 deaths, the second largest Ebola outbreak since the first one was seen in 1976. And lastly, I just wanted to point out something, and this is from, I think, the WHO in the Democratic Republic of Congo Twitter page, and this just tells you the devastation that families can go through when they're dealing with an Ebola outbreak. And it says, Moses Kitsa is a lucky man who survived from Ebola in Katwa after treatment at a ETC, Ebola Treatment Center. But his relatives, 13 people, 13, including his own brother and grandson, died from Ebola virus disease January 2019. So what's he doing? Well, he's riding around on his motorbike in Kitsa, is now mobilizing and transporting contacts to get vaccinated. So he lost 13 people in his family, and now he's working to get other people vaccinated so they don't have to go through the same thing. So God bless you, Moses Kitsa. And that's all I got. I hope you enjoyed the show. Go down below and check out the links. I did a podcast very recently with Dr. Mark Kortepeter. He's with the University of Nebraska, and he's been around for a while, and he's working with Ebola and stuff like that. So he has some good insights on these outbreaks, on the pathology of Ebola, and the difficulties in treating Ebola cases. And it's a very interesting podcast, and I'm sure you'll enjoy it. And I'll see you next time on Infectious Disease News Brief.
And don't forget to check us out at the website, OutbreakNewsToday.com, the podcast, Outbreak News Interviews, which can be found on the website, on Apple Podcasts, Stitcher Radio, and Spotify. And the Outbreak News This Week radio show, which is aired Sundays at 1 p.m. Eastern Time in the Tampa Bay area on AM 1380 The Biz, or online streaming at 1380thebiz.com. And check out our social media presence, Facebook at Infectious Disease News, and Twitter at BackDman63. Outbreak News TV is a production of The Global Dispatch. Copyright The Global Dispatch Incorporated, 2019.